Hi.
Right, perfect. Okay, please
What was
go
that?
ahead.
Oh, hi. I'm Aadarshini Arumugam. Uh, I've I'm a rising senior in high school, and I've built this web application called PCOS Compass. Um, PCOS Compass is an AI-powered web application that people with PCOS can use to track their symptoms, identify trends in their symptoms over time, and access trustworthy educational information about PCOS. The problem is that in the internet, there's a lot of conflicting information about PCOS. It's also hard to track symptoms consistently. There's a limited understanding of PCOS and the symptom patterns about it. People tend to forget their medications or their lifestyle goals over time, and there's an anxiety surrounding when you should get professional medical care. About 10 to 13% of women of reproductive age have PCOS. Up to 70% of women with PCOS remain undiagnosed. Many individuals experience symptoms for years before receiving a diagnosis because symptoms vary widely and can easily be mistaken for other conditions. More than 50% of women with PCOS develop type 2 diabetes by the age of 40. Regular monitoring and lifestyle management can help reduce these risks. So my solution to this is a web application with a symptom tracker, an AI chatbot that's powered by an LLM, an educational PCOS library, a medication tracker, and guidance on when to seek medical care. It's important to know that this is not a diagnosis. This helps people with PCOS because it gives them one place where they can monitor their symptoms, learn about the condition, manage medications, and receive personalized guidance through an AI chatbot, and identify when to seek professional medical care. By improving health awareness and supporting informed decision making, the application encourages better long-term management of PCOS without replacing medical professionals. So enough talking, let's get straight into the web application. So this is my web application and this is the landing page. In the landing page, you can learn more about what this application does. And then when I click launch dashboard here, it'll take me to the dashboard. And from the dashboard, you can go into the different tabs. For example, you can go into the risk assessment tab. You can click here to go do a new symptom tracker for the day. Oh, and you can also go into the Ask AI page. So first, let's start with the risk assessment page. In the risk assessment page, first it'll ask you questions and then give you your risk assessment based off of that. First, it'll ask you your age, your weight, and your height, as well as your waist to hip ratio. And then next, it'll ask you about your menstrual health, like how long your cycle is and whether or not you have irregular periods. And then it'll ask you about common symptoms and whether or not you have these common symptoms of PCOS, such as acne, hair loss, skin darkening, excess hair growth, or weight gain. And then it'll ask you about clinical tests. I'm just gonna add some numbers in for the sake of this demo, but here, once you have some clinical tests, you would input that information.
Okay.
And then it'll ask you about your lifestyle, and it'll ask you about whether or not you have frequent fast food or regular exercise, and then you click on the calculate risk, and then it'll calculate your risk score and give contributing factors of why it came up with that score. So it's calculating it right now.
That's
And
very cool.
that's our risk
Here,
score.
wait a second here. Regular exercise, what does that mean exactly, right? Because different people might define it as differently, right? They say like I could exercise 3 times a day, 3 times a week,
Yeah,
sorry. So does that count or does that not count, right? Like, well, there must be like, what does it mean to be have regular exercise? It's a
I
bit
think
vague,
it's
right?
like I think it's based on like the medical term of what regular exercise is, which I think is
Mm.
exercising every day for about 30 to 60 minutes.
Isn't it like like intensive exercise, like going to the gym level exercise like 3 times a week? So if I remember, but again, I might be wrong there. But
Yeah,
again, the point is like normal people might not know what regular exercise means, right? So
that's that.
maybe you can put something like how many times a day, how many times a week do you exercise, and what like
Yeah,
some.
for
It's not
sure.
that simple, right?
Yeah, I'll for sure add that in the future. And then the next page is the symptom tracker page. It'll ask you like when your period started and when it ended. Let me just input one really quickly. And then it'll ask you about your daily wellness, like pain levels, and then how much energy you have in that particular day, and how much sleep you got. And then it'll ask you about like common symptoms like acne, how severe your acne is, and what mood you've been in, and like medications. And then you can add that in here, and then any additional notes that you might have, you can also add that. Say check-in. So yeah, it got saved. Let me do a couple more, just so then when we get to the analytics page, it's a bit more clear.
Yeah. Okay. So, I like how you did this so far. Like one little critique I might have is like the acne thing, right? Because
Uh-huh.
like what does made acne mean again, right? It's again it's a bit vague.
Yeah,
So you have to be very careful when you design these forms, right? Like they
yeah.
have to make sense.
I'll for sure take that into consideration and figure out a way to like make that like to have
Mm.
it more clear to the user. Thank you for the feedback.
You know
I
what?
can
You know what you can also do, by the way, right?
uh-huh.
Like maybe have like a little chatbot, like rather than having to like fill out a form, kind of, right? Maybe like a chatbot that's like you can just like describe how your what your symptoms feel like. So you just like either speak it out loud or like you can type it out in your own words, and according to that, you'll like figure this out, right?
Yeah,
That can be good
that's
for us.
interesting. I'll definitely look into that.
Yep.
Yeah. So right now we have 3 that have been saved. So then
Oh,
and you
nice.
get the health analytics. You get like what the average sleep was, what the average pain levels were, your average energy, as long with like your sleep and like pain trends and how they correlate. You can find the energy trends that you've inputted, as well as like the mood distribution based on the things that you've inputted in the analytics. So the more symptoms you add, the better the analytics become. And then in the
Nice.
library, you can click here to learn more about, like if you click on this one, you can learn about what PCOS is. If you click on this one, you can learn about the hormones that affect PCOS. And then if you click on this one, you can learn about the lifestyle support.
I think I
And when
got
you
it.
click on,
Nice.
yeah,
Okay.
I'm in
I
the
think.
future, I would definitely add more information to these. And then there's the AI chatbot. Like you can ask any question to it and the AI will answer. Like for example, I'm going to ask it what PCOS is, and it'll give me a response.
Very nice.
Um,
You can change
yeah.
your themes and stuff.
Yes. So here in the settings, you can go. So right now this is in the light theme, and then this is the chart, and then you can go into the lavender theme as well. And then here, I plan to move this part into the dashboard, but here, if you click
Hmm.
on this, well, it should have changed. Okay, so
Reload the page,
it didn't
perhaps.
get, yeah, it changes the color. When I pushed this into GitHub, it didn't push it properly, but it does change.
You might need to reload the page sometimes. That has happened, but good. All right. It's very well made. Really good job with this. Right. Again, like maybe like the thing you're covering over here, right? Oh wait. Was about yeah. Actually, you know what? Do continue. You're gonna finish off, right? Feature
Yeah.
scope and stuff.
So for the future scope, I plan to add a database too that has like the user login. So then like each user can have their own thing. And then I plan to increase the amount of information that is in the educational library. I also plan to have like a feature where the user can export their symptoms as a PDF to show their doctors that way. And so then when they're
All
communicating
right.
with their,
Okay, pause 1 second. You said you plan to add a database, right? How are you currently storing data?
it's
Because
not like it's like each time when you load, it gets
mm,
it gets stored. So
wait, so like
that's
if I
why
reload this page, all that information will will disappear.
um no, I don't. Yeah, it's still there. It's like each time you open it.
Okay, so you have to like right now it won't remember like over multiple days. Is that what you're saying?
Yeah, yeah.
Okay, that makes sense. Okay, yeah, definitely. Then you do need a database, right? All right. Very well made. Look, uh,
Thank
I
you.
guess that's basically it, representation, right?
Yeah.
Very well done, Aadarshini. Right? Great
Mm-hmm.
job on this. Like women's health, especially the stuff related to the ovaries and the reproductive health, uh, is very often ignored in like medical fields as well, right? A lot of people, women suffer from endometriosis, fibroids, and PCOS, as you have said, but
Mm-hmm.
they don't get the medical attention that they require, right? So far you've done very well, right?
Thank you.
Yeah. So it's a great topic to go on. Again, the clear improvements are there in the future, but I think you know how to go about doing them, right?
Mm-hmm.
Right. So keep working on this, right? Maybe you can make this a thing, right? Maybe spread awareness about these diseases, right? Very well done. Okay, you know what? I'll just ask you one last question, and then we'll call it a day, right? So, what is the AI that you're using to keep track, like get the score and all of this stuff, right? What sort of AI
So
are you using?
the score, I built an ML like prediction model to do the score, and then the chatbot is done through Grok API.
Very interesting. Okay, you said you built the model yourself, right? Can you tell me what type of model is that? Is that?
It's like a machine learning model. I combined
Yeah, but
multiple like data sets to come up with it.
mm. Oh, this be a type of model, right? Is it a regression model? Is it a
It
classification
is a
model?
regression. Yeah.
The regression, right? So probably some sort of tree ensemble model, right? Very well done. Okay, cool. All right. One last question for you. Like, what is an API?
Like the API key.
No, similarly, I'm asking what is an API. It's so close.
Um, an API is like it's what you the it's like the thing that produces the
Yeah,
AI answer.
yeah. I think